In these final two videos on insomnia, we will focus on common and usual medications offered for sleeplessness. I'd like to reiterate a disclaimer. This algorithm was developed by a hospice agency, and it is to be used for educational purposes and as a reference source. It's not to be used as medical orders, and your practitioner or agency may have different standards of therapeutic care. That said, let's start from the top. Knowing that you have already provided all of the non-pharmacological interventions, let's reach for a medication. We're going to start with the over-the-counter medications that patients can find in the drugstore. Remember, the patient is your guinea pig, and everyone responds differently to medications. Start with a low dose, go slow, and don't change things up after one trial. It might take 2 or 3 to find out whether it works. Often a patient will say, I tried it and it just didn't work. It might take a little more time. So, try to find out if there's a clear response. And the over-the-counter supplements that we're going to talk about, first, you might start with melatonin in a 3 to 10 milligram tablet or chewy. Why might it work? Melatonin is a hormone naturally produced by the pineal gland, and it's in response to darkness. It helps to regulate the body's sleep-wake cycle. It can help promote sleep onset. So if your patient's having trouble falling to sleep, this is a good choice. And as we discussed earlier, it can help to regulate the circadian rhythm. So it can be useful for the patients who have come out of the hospital or had a disrupted sleep schedule for other reasons. Remember that these over-the-counter supplements are not regulated by the DEA, and in some evaluation of these products, the dosages were quite varied from what was proclaimed on the label. So always choose a company with a good reputation. Okay, so you've started with melatonin. Did it work? Did it start to work, but it wasn't fully effective? So try a higher dose and go back again. Did it cause any untoward side effects, such as vivid dreams that didn't allow the patient to sleep pleasantly? Let's say it didn't work. What other medications do people usually go to the drugstore to get? Lots of people reach for a nighttime sleep aid that contains Benadryl or diphenhydramine. So many of our patients are elderly and already weak. This drug is not a good choice. It has a strong anticholinergic effect, and it can increase in confusion, increase symptoms of dementia, can cause urinary retention, often in older men, gives a dry mouth and constipation. It has effects on the heart and can actually even increase the pulse and the blood pressure. Not to mention that it can really have a hangover effect in the morning with drowsiness the next day. So do not offer or encourage diphenhydramine and suggest discontinuing it if it is in use. The final video will review the medications prescribed by a medical practitioner and are dispensed by a pharmacist. Please visit our website, the Hospice Care Plan, and pick up your copy of our booklet. Don't forget our blog. Make comments, ask questions. That's how we know what more information and support you need. And of course, subscribe to our YouTube channel, the Hospice Care Plan. Remember, Brenda and I are the care queens because our motto is care is treatment.